Place the defib between the patient's legs and access the chest wall by removing clothing using zips, or if you have tough cut scissors, cutting up the clothing from the centre of the chest, which will displace an underwire bra if the victim is wearing one. Standard pad placement is placing the pads underneath the right collarbone and underneath the left armpit. But you must consider what is on the patient's skin at this point in time. If they have obvious medicine patches, remove them from the skin. If the patient is wearing jewellery, that can be flicked to the side. If the patient has dermal studs, this will be impossible to remove during cardiac arrest, but you must avoid placing the pads directly on top of the stud. If the patient is very hairy, then you may consider shaving, but during cardiac arrest this can be quite tricky, and so alternative pad placement can be considered, and where you can place the pads in a bi-axillary fashion under both the left and the right armpit. This might also be required if a patient has an implantable cardiac device. Most implantable cardiac devices are implanted underneath the left collarbone, but for some reasons they can be implanted underneath the right collarbone, and therefore you wouldn't want to put the pads directly on top of an implantable cardiac device. They can be identifiable by a bump in the skin and a scar. And so in this case, you may also consider the bi-axillary pad placement. Before placing the pads on the chest wall, you will need to dry the chest of any excessive sweat or vomit that the patient may have then. So open up your defibrillator and switch it on. Follow its prompts.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So using the diagrams, we can place this on the chest wall, eliminating any ear pockets.
Apply pads.
Smooth
Plug
out
in
the pad.
connector.
And again here, smoothing out any ear pockets that may be there.
Analyzing heart rhythm. Do not touch the patient.
Everyone's clear.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Everyone's clear.
Shock delivered.
And start.
Pause. Start CPR.